Okay, thank you everyone for joining. So I have made few of you as a co-host. Um, I think Dr. Ali, Dr. Ashish. So just look at your names, and if there is anyone waiting, so just kindly help me out in accepting them. So I have been approached by many of the students that they just want to have an orientation session. So when I checked my lectures, I found that I have a DCH orientation lecture, but I have never one for MRCPCH. So that's why I just had this thinking that let's do it for the benefit of the students who have just finished their um theory portion, and they are planning to go for the clinical one in the near future. I think it will help them a lot. Someone just acknowledge me, I'm audible. Anyone just can unmute yourself. Let me know I'm audible.
Yes, sir.
Thank you. So it is basically very basic sort of a lecture. Whenever you attend something, just ask yourself why I'm attending this. Okay. So basically, this lecture is all about to know the ABC of the MRCPCH clinical for someone who are very new, who have no idea about this, who have just gone through their theory portion, and they just want to know a bit more about the clinical portion. So this lecture will definitely help them, and it will just make their journey to the through the clinical portion a bit easier. Okay, a little bit to have an idea about the exam pattern. So this slide gives you an idea of the exam pattern. There are total around 10 stations in this clinical exam. It is a bit different from that of the Irish MRCPI, in which usually we have around 5 stations. So here it's almost double. Okay, like here you can see that the communication stations, there are two video stations, there is one history station, and there is one development station, and there are basically four clinical stations. Okay, if you compare that with the Irish, so the Irish MRCPI, that has uh, one communication station, it has one history station, and it has one development. So three, and it has two clinical stations. Totally, it becomes a five. So that is a sort of a little easier as compared to that of the MRCPCH clinical UK. Okay. If you talk about the marks distribution, so the marks distribution are like the uh, clinical station, as we said, there are four. Each station has 8 marks. Okay, so it I mean four stations, so eight fours are 32. So the clinical stations, they have 32 marks. Then when you come to the communication portion, so communication usually it has two communications, so each has 8 marks, so 8 into 2, so that is 16. Video, there are two video station, and each one has 6 marks, so 6 into 2, that is 12. Okay, then when we come across the history station, so there is a one history station and it has 10 marks, and development station, it has 12 marks. The development station, it 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 has two portion. One is the theory portion and the history portion, which is called a developmental history, and it has then another portion which is the clinical portion, in which you will be taking the developmental examination of the child. Okay, so that is a little bit different. So that is a total, it's a sort of a marks distribution. So if you see this I'm talking about the latest one. Okay, previously it was 120 marks, and out of that you have to score 100, but now it is different. So I'm just talking about the latest one. So the marks distribution is that you have a total of 82 marks. Okay, and out of this 82 you just have to score 62. And now from the last exam, from the last diet, they have introduced one more thing, that any candidate who has a score of less than 52, so there is bad news for such candidates, that they cannot appear for the next diet. Like, for example, there is a candidate, he appeared in diet one somewhere, and he has around 50 marks. He could not qualify, unfortunately. So what, he cannot appear for the next diet anywhere in the world. Okay, he just have to skip one diet, and after that he'll be applying for that. So that is something which they are doing every now and then. And I think it's a good thing. I mean, if someone has a bad going, so they just want to give him some time, that candidate. So this is the latest thing which they have introduced, I think from the last diet. Okay, now let us talk about each of these stations a little bit, a little insight, a superficial insight of every station. So let us talk about the clinical station. So, I mean, the clinical station, it can be either from a CVS, it can be from a CNS, it can be from a gastroenterology, respiratory, musculoskeletal, and there is one other thing, others. Now, others can be anything, like it can be a GP, general physical examination, for example. This is a child, just do the GP of this child. It can be from a skin. Like, for example, my command in my clinical exam was that examine the skin of this child and proceed. Honestly, like that was a horrible command for me. I never was prepared like for something like that. So he said skin, so I was just thinking that okay, just 1 minute, please. Okay, so the command was to examine the skin of this child and proceed. So that was something very new sort of a command because it never happened before us. But anyhow, I mean, when you get used to these things, when you practice, you get used to these things, and things are very much obvious. Things are very crystal clear, obvious. It's only if you have a good practice and if you have a good clinical background, so then I think it's not that difficult. Um, in other system, it can be like anything. As I said, it can be a GP, it can be a child with a syndrome, it can be, I mean, it can be like a sort of command, as I said, that examine the skin of this child. It can be a neurofibromatosis. It can be a sort of some neurocutaneous sort of stuff, and they can ask you, for example, neurofibromatosis or anything. So cardiovascular, I mean, there are total around 6 to 8 cases which you have to prepare well. And because now the exam is running face to face, so these 6, 8 cases, I advise always my students who are doing courses with me. So I just tell them that these 7, 8 cases, what you need to do is that you just have to listen to the murmurs of these 7, 8 cases just before your exam. And I mean, when you go to the exam, you have at least heard those murmurs before. Otherwise, I mean, it's difficult. Similarly, CNS, it's one of the station which is a little bit wide station. There are many things which you have covered in this station. CNS, as you know, it's a lengthy one. It gives you anxiety, but usually things are not very much difficult which are coming from exam. Like it may be sometime an awkward sort of a command can come. Like for example, this is a big skull, and examine this child. For example, a hydrocephalus congenital one or acquired one. Uh, but usually, I mean, very straightforward command is Sometimes the command can be that this examine the gait of this child, and usually you need to know the different gaits, and then it may turn out to be a case of a hemiplegia, and you just do the neurological examination of that child. Previously, it was like this, that they used to give you a 3 minute reading time before entering into the station. For example, you have a cardiovascular station, so you knew that the case I'm now going inside is a cardiovascular case. But now the things are changed. Now you don't know. You will just wait outside on chair, and you will not know that what case is inside. When you go inside, the examiner will tell you that this is a child and just do the cardiovascular examination. So these are the things which every now and then they are just bringing into consideration. But in clinical station, yes, you can read books, you can read many things, but there are two things on the basis of which they are just assessing you. Uh, you just have to kindly watch out your mics, okay? If you're not talking, so you just have to be silent, please. So clinical station, because it constitutes 32 marks, fourth station, so you have to prepare it two ways. Number one is that you need to go to your wards, okay, and the most common cases which are coming time and again, you just have to do that practically by yourself. Because if you're doing it in a course or in anything, the examiner or the mentor, he cannot tell you, he cannot show you that how to palpate for the spleen. Yeah, he can show you, he can tell you that how to palpate for a spleen, but he cannot tell you that how centimeter the spleen is. That should be your perception, and that perception comes once you have done that yourself practically. Okay, so I mean, the mentor can teach you that how to do the fluid thrill, how to do the shifting dullness, but you should have done that before, so that it does not look awkward on the day of exam. Because what I've seen is that the examiners, they're not only looking at your skills, but they are also looking at how mature your skills are. Okay, and the skills, they got mature once you have done it many times before, okay, by yourself. So what I say, that at least you should do it by yourself. You should have a partner or two, and you guys should go to the wards, and these common cases you should be doing by yourself. Similarly, respiratory musculoskeletal, I'll be taking questions later on. So then we have the second station, that is a communication. Again, communication, it has two stations. It constitute around 16 marks. Now, these are the different type of um headlines from which they can come. I mean, either it can be an information giving sort of a scenario, in which, for example, some sort of information you just have to give to the child. For example, you have been asked that this child has a case, he had an anaphylaxis, and now you just have to teach him about the EpiPen. So it's an information giving sort of scenario. Sometimes a consent scenario is there in communication. Like, for example, we this is a meningitis, and we just have to tap, do CSF tap. So you just have to take consent. Sometimes procedure, okay, like for example, there is ascites, and then you just want to tap it, and that procedure you just have to tell to the parents. Sometimes it's a breaking bad news, like for example, this child was anemic, you did CBC, and that turned out to be leukemia. So in every type of scenario, previously it was like this, that they was mostly concerned with your communication skills, and they were less concerned about your knowledge about the topic. But nowadays they are concerned with your communication skills as well as your knowledge about the topic, about the subject. Okay, so whatever your topic is, for example, leukemia, so they might ask one or two questions regarding the leukemia, which are very common, not difficult things. But I mean, knowledge portion is there as well in communication now. Sometime out of the blue, sort of difficult scenarios, like for example, a difficult colleague, for example, uh, you are two colleagues, and your friend is coming late on duty, so you just have to wait for him more. Like for example, if it's a 9 p.m. switch over time, and he usually comes at 9:30, so you have to wait for him until he comes. So this is a difficult colleague scenario is also there. Sometimes a critical incidents, for example, one drug is written, and in spite of that drug, the nurse inject another drug. So these type of scenarios, sometimes ethical scenarios. Usually ethical scenarios are a little bit difficult, because ethics, it's easy for someone who is working there in UK, but someone who is not working there in UK, and the scenario of UK ethics come for them, so that is a little bit troublesome for them. So this we have to look into it. Sometimes this gives us a little bit of time, and sometimes education sort of scenarios comes. Recently, sometimes they are introducing new sort of things, like for example a telephonic discussion. For example, they just tell you that a child came to you, and you did wrote some investigation for them, and now there is some problem in the investigation, so you just have to call to the mother and tell her about the investigation and counsel them to come to you and see you. Okay, so these type of telephonic discussion scenarios are also sometime common in exam. So all in all, these 8 9 different spectrum of scenarios are there. Many of the students, they ask that how many scenarios we should be doing. I think that is not a good idea. What you need to do is that you need to make an approach to every type of scenario. You need to make an outline to the type of scenario. For example, if a consent come for me, so how I should proceed with that. If an information giving come for me, how I should proceed for that. Okay, and then there should be one very common sort of approach. Like for example, for any communication approach, if you ask me, I'll be thinking that there should be an entry portion where I should be greeting, I should be setting the agenda, and I should be asking if she wants someone else to be around in this communication. And then there should be a body portion in which I'll be talking about the subject which have been asked from me. And then there should be an exit or sign out portion of my communication in which I'll be just leaving and summarizing the stuff. So you just have to make one big holistic sort of an approach for yourself, and uh, I mean that will be easy, because I mean there are books in which there are hundreds of scenarios present. So it cannot be like this that you remember all 100 of them. Okay, and it's not possible to remember all of them. And communication, by the way, can be anything. So you cannot expect it. So therefore, just try. I mean, make a sort of an approach in all this clinical exam, that make a sort of an approach in which you just make an outline for you that what I'll be doing in communication. So any type of scenario comes, you will be good in that. Okay. Videos. I mean, they many of my students, they ask me that how to prepare the video station. I think video station is like, the simple answer is to watch as many as you can. I think that's pretty much simple. And most of the videos nowadays which are coming, they are, and they must include the emergency videos, like for example group, for example epiglottitis, for example viral wheeze, for example acute asthma, for example status epilepticus of a child, acute seizures. So the guidelines which contains the acute emergencies, so at least you should go through that, because uh, I think knowledge is required only in two stations. Okay. In the other station also required, but that is a superficial one. But in two station, knowledge is required a lot about the topic, about that subject which is there for you. One is a history station, okay, because in history station the examiner has 9 10 minutes, and he'll be discussing with you about that topic. For example, your case is a UTI in history, so he has 10 minutes discussion with you. So you need to have a very sound knowledge about that topic. whichever your topic is on the history. So that is one case in which knowledge is required. And the second one is a video. In video also, you, for example, the top, you saw a video in which there is a hemiplegic gait of a child. So you need to know a knowledge about a hemiplegic gait, that what are the causes, and what are the condition which can lead to hemiplegia, and how we gonna investigate, how we gonna treat it. So I mean, knowledge about that topic is important in video. So these two are the things in which knowledge is required to somehow. Time is not an issue in video. It is one of the station in which you will be sitting and just chatting with the examiner. So time is not an issue over here. Rest of the station time might be an issue, but here it is not an issue. Talking about the history taking or the history station, I think it's a skill, as you know, and you just have to develop this skill, and how this skill is developed, I think you just have to struggle for it a bit. You should see books, you should attend different lectures by different mentors, and you just have to make a notes for yourself, because this history taking is very different from the history taking which you already know. Why? Because here there is an issue of the time. You just have to do it in 13 minutes. So that is very important. And I usually quote that you just need to become a good driver. Okay. Once you become a good driver, then doesn't mean which, it doesn't matter which car you're driving. So how to become a good driver? So it's important that you need to see different books or history taking, and you need to do different sort of type of discussions. You need to do past recalls of the history. You need to see the spectrum of different type of histories, that what type of histories are coming. Sometime acute histories are coming. For example, suddenly a child presented with choking epiglottitis. So sometime chronic histories are coming. For example, a child with chronic diarrhea. Sometime acute on chronic histories are coming, that a child with sudden weight loss, and when you start taking history, you come to know that, yeah, this child has developed hyperthyroidism. But when you go deep into the past history and rest of the domains, you come to know that this is hyperthyroidism, but he's a known case of celiac disease. So acute on the top of a chronic. So there is a chronic condition in the form of celiac disease, but now he has developed hyperthyroidism. So these are the different spectrum of disease. Few of them I just told you. So you just have to work a little hard in this station. Not difficult, but you just have to check out many mentors, many people. You have to attend many classes. You have to listen to different type of peoples, and you just have to make a sort of a template for yourself. Okay, once you make that template, I think then history taking will be easy for you. One of the station which is giving anxiety to, I think, everybody on the globe, which are appearing for this exam, including me, when I was preparing for this, honestly, I had a lot of anxiety from this station. This is a fact. Why? Because we are not trained that way. This is a totally different stuff. Okay. Uh, I think if you ask me from where we should cover it, it's very difficult to answer. Okay, it can never be covered from one book. If someone say that it is good in Mark, someone will be saying it's different, good in Malaysian book. Someone will be saying good in blah notes, blah 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 blah. But I think the best person are you yourself. Okay, you just make your notes from different books, see 4 or 5 books, make your own notes. Okay, because there are only gross motor, fine motor, hearing and speech, and the social, and the few typical scenario like the artistic spectrum disorder or developmental regression, or these 5 6 scenarios. So you can make your notes easily, and just follow those notes time and again. Okay, I think what happened to us, most of my colleagues, they were very good, they were brilliant, but what they did, that they just memorized it. That's good, yes, memorize it, but I mark my words that you cannot keep them in your mind for more than, I think, 1 week, because they are so volatile that you cannot memorize it. Okay, so try to learn the skill of development. What I mean to say is that try to learn it. Try to, when everybody has kids in home, just see them how they are growing, okay? And similarly, try to do it practically. Like for example, two people, they are preparing for exam. So try to do, for example, ask him, the for example, one of you should become a child, okay, and the second one should become a candidate, and just, I mean, do it, practically do it. For example, bang the cubes, for example, make a tower, or just, you know, find a child in your home, and just see that what is his developmental age, and then just do it practically, okay? And I think that will help you a lot. And it's very important that there should be a flow in this station, okay? If I mean there is no flow, then I think the examiner will not be happy. Hanging phenomena in this station is not good. And along with that, there is a developmental history, which also you need to prepare well, because developmental history is totally different from the history which you already have seen, like the other history, the routine history. So this is a totally different history. So for this also you have to struggle, and you have to make a good template for yourself for developmental history. I think when newcomers or people who are like newcomers for the MRCPCH clinical portion, for them the advice which I will give them, that is that what you should do is that, for example, now you're preparing for a history station. So before preparation of the history station, read the anchor statement. What is an anchor statement? I'll be sharing that in the group. The anchor statement is basically the anchor statement is basically a material in which you have been told that what the examiner is demanding from you. Okay, like for example, you have a history station, and you are making a history, but in that history you don't know what is the requirement of the examiner from me. Like the examiner wants to see your confidence, he wants to see your flow, he wants to see your communication skills, he wants to see that I mean how your behavior is with the role player, with the patient. So there are many things which are there, and the examiner wants to see those things. So what you need to do is that you need to read the anchor statement before. There are three columns in that. One is a uh, one of the column is like a clear pass column, and one is a column which is fail, and then one is a clear fail column. So you just have to concentrate on the clear pass column, and you just have to see those things, that what the examiner is wanting from me, okay? So anchor statement is very important. These are total, I think, 5 or 6 pages. So you just have to, you can easily see that from RCPCH site. And in many groups, this is also present. I can share that with you people as well. Yeah, that is another technical question, that how much time is required. Many of you, definitely these things will be coming to you, particularly someone who is new to this subject. I think it depends upon from person to person. Like, for example, there is a candidate, he has done a local post graduation of his country. For example, someone is from Bangladesh, he already or she has done FCPS, or at least he or she has done training of that. So that candidate is totally different from someone who has not done anything and he's working as a GP in UK. So that candidate is different. Okay. So your pediatric background is very important. If you have a good pediatric background, if you have worked in a tertiary care hospital, so I think, 3 to 4 months is enough. But for someone who is, you know, who has not a very good pediatric background, so for him around, I think 5 to 6 months. So on average, we can say 4 to 5 months, I think, are enough. Okay, but there should be practice with each other. And I tell you, it's not more about a knowledge. Okay, knowledge, I think you guys have already the certificate of the knowledge because you guys are passed, but it's a skill. It's a skillful exam, and it's totally different from the two exams which you guys have passed already. Talking about books, definitely you might be thinking that what books should be seen. So, as I said, I think there is less involvement of books, and it's more a practical approach. This is what I encourage. But definitely, there are books which you have to go through, like the Mark. It's a very good one. Heather for history taking. You just have to go through that once, at least once or twice before your exam. It's a very good book. Particularly, your discussion portion is covered from this Heather very easily because so much detail is given over there, so it can help you. There is a Malaysian book, Secret of Pediatrics. It has written a very good few things, like, for example, the scars, surgical scars are beautifully written over there. And similarly, for example, Development Station has very beautifully written over there. And you have to have a hold on the guidelines, the pediatric guidelines, you have to read it. And if you ask me that for clinical methods, which book we should read, so Hamish Wallace, I just myself I read this book, Hamish Wallace. That's one of the very good book. It's a big book. You don't have to read everything. You just have to read the clinical methods. Okay, there are cases given in it. There are long cases, short cases. You should not read that portion. Only the clinical portion. Like for example, respiratory. So just the 2-3 pages of the respiratory examination. Forget about the other thing. Then CVS, so just read the 4 pages of the cardiovascular examination, how to approach it. That's it. Similarly, CNS, respiratory, and rest of them. There are many WhatsApp groups. There are many Telegram groups. I think they help you. They are good. They help you a lot. When I was preparing for my theory portion of MRCPCH, I didn't know about these things. But once I finished my theory portion, and when I entered into my clinical portion journey, so then I came to know about different groups and I joined them. And honestly, I learned a lot from them because every now and then, different type of mentors they are talking about. Everyone has different approach. My approach might be different. There might be someone else whose approach might be different, and all of these approaches will help you. It's not like this that someone is good, someone is bad. No, everyone has some potential and everyone is good in some domain, and they can help you. Okay, so you just have to uh, gather the knowledge from different areas. It's not only that you just become a bookworm and then just sit and read. No, you just have to join these groups. And also I found these groups beneficial because every now and then people are sharing materials, and you might get some material which might be very much helpful. I think what you need to do is that what I did myself, that total there are 5 stations, okay, like communication, development, history, clinicals, and the video. So what you should do that make 5 notebooks for yourself. And whenever you find some good point or something good, so just write down in that particular copy. For example, you were attending a lecture from some mentor on online session, and you just found some few good things about that. So you just write that in your notebook. And believe me, when you'll be near to your exam and when you read these copies, these few pages, okay, so that will be very, very helpful for you. And it will be really, help you. Because, books, knowledge from books, it does not last much. But if you have written by yourself, so that lasts much. You'll be asking about different courses. I don't say, if you ask me that is it mandatory to undergo any sort of courses, I don't say that, you cannot pass or one cannot pass without courses. I myself have not done any course up till now in all my MRCPCH journey in my theory clinical. I never did any course. I even didn't know about them that there are courses. So you cannot say that you cannot pass without courses, but they make your journey easy. particularly someone who is very busy life, and you don't have time, you don't have time to concentrate on something. So, I mean, the different courses, they just can help you in a way that they can make your life easy, they can make your journey easy. And particularly for someone who has, I mean, not a very good clinical background, or who has not worked in a good clinical setup. So, for such type of person, I think it can help a lot. Okay. And anyone, if you want to contact me for my WhatsApp group or anything or any help, you just can contact me. This is my contact number. Yes, now it is open for everyone. Anyone, if you have any question, you just can ask me. It's just a sort of orientation, just to know a little bit about the clinical portion. Anything, any question which is coming into your mind and you just want to clarify it, yes, I can answer that. Okay, I think if there is not anything, so we just can conclude. Let us see, there are a few messages in the group. You just can unmute yourself and you can ask me. Like, is it fine if we delay exam for 1 or 2 diet? Yeah, I mean, it's okay. You just can see yourself that how is your preparation, and according to that you can do. I mean, you can delay it. It's not an issue. Yeah, this is a very difficult question. Like, there is one question that, are there specific books to follow for each station? Yeah, that is a very technical question. As I've told you that, yeah, there are things. I mean, Sushmita is asking, like, there are few things which you need to see from particular books. Okay, like for example, uh, like Dr. Sushmita, you are like with me in my course. So what you need to do is that, for example, at the moment we are doing history portion. Okay, so with every station, I'll be telling that from where you should try, from where you should, study. So this history portion, what you need to do is that give a read to Mark, okay, the history portion, and give a read to Heather. So that's it, nothing else, and my lectures. That's it. So when we go to communication, then I'll be talking about the communication, and when we go to development, so I'll be with every station I'll be telling you. But yes, one book is never complete. You have to see many things around. But one of the best book is Mark. Mark is an excellent book. The bad luck with me was that I came to know that Mark is a good book very late, and still, I still remember that I gave a very fast reading to Mark, but only once read. So I think that was not good. Um, I think you should give at least 1 or 2 read to that. Okay. Dr. Shanaz is asking that some doctors appear DCH clinical before MRCPCH clinical. Do you think it's helpful to pass? Well, Dr. Shanaz, actually, our journey for MRCPCH clinical was very lengthy because there was COVID, and we had to wait for 3 years. I got my clinical slot after 3 years. Okay. So that was a very tough time. In that tough time, it was a sort of a frustration. Already there was, I mean, COVID, people were very much, you know, depressed. It was a tough going. So at that time, like, I mean, they said that DCH is now online. So we said, okay, if there is no exam going around, so we should apply for DCH. So we got a slot, and we just appeared and we passed. And then we encouraged people. When we were appearing for DCH at that time, honestly, we didn't know anything about it. We just applied for it, and just before I had a DCH lecture, just now I finished my DCH class because my students, they have DCH exam starting from tomorrow, day after tomorrow. So just I told them exactly the same thing, that we had nothing. So only 32 days before they told us that you are selected for DCH if you want to apply. So I applied, and this 30 days we studied. We had no book, only one blue book, and we just studied that, and we pass. So there are two benefits of this. Benefit number one is that you get one extra qualification, and the benefit number two is that I mean, exam is totally different. Pattern is different, Dr. Shanaz. The pattern is like the history of the DCH and the history of the MRCPCH is totally different. DCH history you have to take in 9 minutes, 6 minutes, sorry, because 3 minutes is a discussion portion. And MRCPCH history you have to take 13 minutes, and then 10 minutes is the discussion. So totally different. The type of cases which are coming totally different. Okay. And similarly, the communication totally different. Although time is same, 9 minutes, but the type of cases are the GP cases which are coming for you. Like not, I mean, a newborn baby with neonatal jaundice come to you. What you're going to do? A child came for vaccination. What you're so basically, I mean, you need to be in a shoe of a GP. So totally different. So I think it's not mandatory to appear for DCH before your MRCPCH clinical. But if you feel that you want to take one extra qualification, and if you feel that your exam is very far, your clinical portion, and you want to do something in that, so yes, then you can take it, because nowadays it's online, but you never know when it will turn face to face. So for that reason, you can do. Otherwise, I think if you think that it can help you, I don't think so. Only it can help you in your MRCVCH clinical in this way, that you will be, when you pass it, so you will feel confident that at least I have done one qualification. That's it. Any other question anyone have? These were the questions. Okay, I think this is my contact number. If you have any question later on, you just can contact me. I'll be happy to reply you. Thank you so much. I'll just upload this on YouTube as well. Okay, how many attempts in 1 year we can give? So I think there are 3 attempts in a year. Okay, diet one, diet two, diet three. You can give 3 attempts. The only issue is that you should not take less than 52 marks. If you have less than 52 marks, you will not be allowed uh, to sit in the next diet. Otherwise, you can give all of the 3 attempts. And for Pakistan, there are 2 diets. Yes, one is the diet two, and the other is the diet three. And you can see that on the RCPCH site as well. Thank you so much for being around. Thank you. Take care. If there is any question, anything, you just can answer me personally. Okay. Thank you. Take care. Good night.